where President-elect Donald Trump has been continuing to unveil his major cabinet nominations for when he becomes US President in January. Well, these are just some of the key announcements made in the last few days, including Marco Rubio as Secretary of State, the former Democrat Tulsi Gabbard for Director of National Intelligence, and the controversial appointment, of course, of Matt Gaetz as Attorney General. Several of the posts will require Senate approval. Mr. Trump has also selected his former rival, Robert F. Kennedy Jr., who's well known for his vaccine-skeptical views, to lead the Department of Health and Human Services. Mr. Trump made the appointment, or rather the announcement, on his Truth Social platform, saying Mr. Kennedy will restore agencies to the traditions of gold standard scientific research and beacons of transparency to end the chronic disease epidemic and to make America great and healthy again. And in the last few hours, Mr. Trump had more praise for his former opponent. Our correspondent, Rowan Bridge, has the story.
America could soon have a vaccine skeptic who repeated COVID-19 conspiracy theories running its health department. Robert Kennedy Jr. comes from Democratic Party royalty. His uncle was President John F. Kennedy and his father was Attorney General. Mr. Kennedy made his own name as an environmental lawyer and activist, but that's been overshadowed by his controversial views on vaccines.
Do I want children to get measles? Of course I don't. I have
so why do you spread this doubt?
Because when I'm asking you to be responsible and ask the question.
The questions are being asked. The vaccines are safe.
The vaccines are safe from what? Do vaccines cause autoimmune disease? I'm in court right now arguing.
There's no evidence they do.
Well, there's plenty of evidence that they do. You're just not looking at it.
Last year, he launched an independent bid for the presidency before dropping out and throwing his weight behind Donald Trump. He was one of the speakers at Mr. Trump's New York rally, where he condemned the party his family had dedicated their lives to.
Today's Democratic Party is the party of war. It's the party of the CIA. You had Kamala Harris giving a speech at the Democratic Convention that was written by neocons, that was belligerent, pugnacious, that talked about the domination of the world by the United States through our weapons of war. It's the party today that wants to divide Americans. It's the party that is dismantling women's sports by letting men play women's sports. It's the party of Wall Street. It's the party of Bill Gates, who just gave $50 million to Kamala Harris.
His loyalty to the Trump cause has now been rewarded. In a speech at his Mar-a-Lago resort, the president-elect praised Mr. Kennedy.
I just looked at the news reports. People like you, Bobby. Don't get too popular, Bobby. Oh. You know, you've reached about the level. Now, we want you to come up with things and ideas and what you've been talking about for a long time, and I think you're going to do some unbelievable thing. Nobody's going to be able to do it like you, and boy, does he feel it in his heart. So congratulations also to your family.
During his campaign, Donald Trump said he would let Robert Kennedy go wild when it comes to the nation's health. Mr. Trump vowed to shake up the establishment. This latest pic shows he plans to do just that. Rowan Bridge, BBC News, Washington.
And Rowan joins us live now from Washington. Hello there to you, Rowan. So a lot of headlines being made regarding these announcements. Who are we yet to hear from in terms of roles?
Yeah, I mean, there are a number of roles still to be filled. I think perhaps the most important being Treasury Secretary, the person in charge of the US finances. There are a number of names in the frame for that, perhaps most prominently Howard Lutnick, who was the co-chair of Donald Trump's election campaign and is the chief executive of Cantor Fitzgerald, the investment company. He's one of a number of names in the frame, but it's not clear at the moment exactly who it will be. There's also somebody like Scott Bessonette, who's an economic advisor to Donald Trump, and a investment banker whose name has also been put in the frame. So there's a number of other cabinet posts still to be filled. But I think what you have seen from some of the names that have been put forward, particularly Matt Gaetz and Robert F. Kennedy Jr. is that Donald Trump is prepared to put forward names that will shake the establishment, people who are going to shake things up. And I think that is a sign of the confidence that he's feeling off the back of the victory that he's got. And you got that sort of sense of that in the way that he was talking in his speech in Mar-a-Lago this evening. He was relaxed, he was confident. He talked about how the victory was the greatest in 129 years. And I think he's really basking in that.
There's a difference between shaking things up, being disruptors, and then running the country. Does he have the general support of Republicans, particularly in getting some of these roles through Senate? What's the feeling around that?
Yeah, I mean, I think some of these may be a challenge to get through. I mean, it's not clear, for example, whether there will be the votes to get Matt Gaetz confirmed as the Attorney General. Matt Gaetz was a polarizing figure within the Republican Party. He effectively cost the Speaker of the House his job, the last Speaker of the House, when he refused to back him. And he has made political enemies within Congress, so he is not a uniformly liked character. He's also facing an ethics investigation over allegations of illicit drug use and sexual conduct, allegations, I should say, that Matt Gaetz denies. Now, at the moment, the Republicans have a 53-seat majority in the Senate, so they only have a very little wiggle room in terms of getting some of these nominations through. And if they lose 4 votes effectively, then that means some of these nominations might not pass. And Matt Gaetz is one of those that is particularly controversial. Also, the Defense Secretary, a Fox News host, is another potential who may face trouble in the Senate. It's not really clear if either of those in particular may yet get through the vote.
And finally, Rowan, I understand that Mr. Trump has been hosting some pretty high-profile supporters in Mar-a-Lago. Any idea as to what he's been saying?
Well, yes. I mean, Elon Musk was down there. Robert F. Kennedy was down there. The president of Argentina was down there. There is a sort of conservative political action conference taking place at Mar-a-Lago over the next few days, and he was addressing them at a black tie dinner this evening. I mean, he was in very relaxed mood, very jovial mood, as you heard in that piece. He sort of joked about Robert F. Kennedy not getting too popular. But I think he was really in sort of magnanimous mood because he's feeling very confident and boistered by the sort of coverage that he's got because of the electoral victory that he's managed to pull off for the Republicans and the fact that he now has the House and the Senate and is in a position to really push forward his sort of America First agenda.
OK. Rowan Bridge, we'll leave it there for now, but thank you very much indeed. Well, Dr. Georgia C. Benjamin is Executive Director of the American Public Health Association, and he explained more about his organisation's opposition to Robert Kennedy's appointment.
Well, he doesn't believe in vaccines. He said there's no safe and effective vaccine, despite what he's saying today, and we have him on the record at that. And what would happen if we had another pandemic from a vaccine-preventable disease, that more people would get sick and more people would die. And that's absolutely not the thing that you want for your chief health strategist to have those views. And he's also never run an agency that has the largest health insurance program in the country, that's had a large research enterprise, that is out to do health promotion and disease prevention. These are not skills and expertise that this man has.
Well, for more now on President-elect Trump's choice of health secretary, let's speak to Dr. Sira Medad, an epidemiologist and leading public health expert based with the Harvard Kennedy School in New York. Dr. Medad, hello and welcome to the programme. So what are your primary concerns with this appointment?
Well, I think there's 2 big problems that I'll lay out. First is he is, unqualified. He has no credentials. He's not a public health expert. He's not a medical expert. And this is obviously a very large, health position that he would be potentially running. The second is he has over 40 years of anti-science sentiments, and he has been propagating multiple different, anti-science theories. Some that you just heard. He's a anti-vaccine skeptic. He, has propagated multiple different mis and disinformation on a number of different public health interventions. And so he's a known and prominent anti-vaccine skeptic. He's an anti-science individual. And so running, multiple different institutions in the United States that oversees food safety, biomedical research, outbreak response. Like, these are really big roles that impact the lives of Americans on a day-to-day basis. This is dangerous.
I mean, it has been years, hasn't it, since the US has had somebody in that role with those credentials that you mentioned, those medical credentials that are needed. What power does he actually have? Let's take, for example, something that everybody, most nations can relate to, and that is polio, for example, or measles vaccinations. In the West, we are very, very privileged not to see this disease. Often it is coming back. But on that, what power does the Health Secretary have in changing vaccine mandates?
It's an excellent question. As somebody in the position of HHS Secretary, you have oversight over CDC that recommends the routine immunization schedule, for Americans. And so he can have influence on how in that particular immunization schedule, whether you're mandating it for school-aged children or you're not recommending it as routine vaccinations. Ultimately, states decide, on many of these public policies, but at the federal level, when you're putting these types of recommendations out, it certainly trickles down to the state and local level and has influence. And as you talk about measles here in the United States, we're already over 270 cases this year compared to last year where we had 60 cases. So these cases are increasing. They're not decreasing. We're living in an age of multiple different infectious diseases. Just, recently, RFK Jr. went on a news outlet and he mentioned that he would pause infectious disease research, when it comes to NIH. These outbreaks are not going anywhere. So pausing what research? What is that going to do? That's only going to harm Americans.
Okay, let's move on to obesity. He has, though, on the other hand, said that he wants to reduce people's consumption of processed food. For Big Pharma in the US, obesity is great. It's a huge money earner. What are your thoughts on this?
Many of these, different stands that he's making, are certainly based on nuggets of truth. So certainly we have an obesity epidemic in the United States. Certainly we want to take out ultra-processed food. We know that's not good for anyone's health. But what are you replacing that with? You want to replace that with nutritional food. And so when you talk about nutritional food, what does that mean? And if you're a anti-science skeptic, you're not necessarily going to go with evidence. And so, what are you going to be putting into American diet? So it's really important that you follow the science and you follow the evidence, and his leadership has proven that he doesn't follow the evidence or science. So sticking to one point, but then not really looking at the side of science and evidence, that doesn't really match up.
Dr. Madad, when we talk about leadership then, if you're not happy with his appointment, who would you like to see in that role? Who is best suited?
And that's a great question. And as someone who is in the public health and healthcare industry, I certainly want to see somebody that has a track record of promoting science, promoting evidence, working with the people, has a good background and understanding of just really how science works and how to have good oversight in health policy. There's a number of different Americans in the United States that have those particular credentials. So there is a good field to choose from. Unfortunately, having a nomination of RFK Jr., where everybody in the public health community is up in arms, that certainly doesn't bode well.